Dr. Garrett Wegerif here at Pure Plastic Surgery. I am a double board certified plastic and reconstructive surgeon here at Pure Plastic Surgery in Miami, Florida. Today we are doing Thursday Thoughts, and we're going to be going over a few common questions that we often get. So feel free to chime in if you have any additional questions. I'll be happy to answer those for you towards the end of this. So jumping right into it, how do I decide if a BBL or a Brazilian butt lift is right for me? This really comes down to a few main things. One is you need to have minimal skin laxity. If you have a lot of skin laxity, we're really going to want to think about doing an abdominoplasty or a tummy tuck prior to doing the BBL. The second thing is if you want a bigger, more shapely butt, that's what we're going for. That does not mean we have to do this super exaggerated, huge butt. It's just enhancing your natural curves. So here at Pure Plastic Surgery, I personally and both of my partners, we really like to achieve natural results. So we do BBL. Some people are scared off by the thought of a BBL because they've seen those very exaggerated patients. We're trying to accentuate your natural curves and give you a little more beautiful shape. Is it possible to combine multiple procedures like tummy tuck and liposuction? Yes, it is, and we do that all the time. The one caveat here in Florida is we're limited with how much liposuction we can do when we're combining it with a cutting procedure like a breast augmentation, a breast lift, or a tummy tuck. And that limit is 1 liter. So often when we're doing a tummy tuck, that's the perfect amount to do some of the flanks. Or if someone's getting a breast procedure like a breast augmentation, we're often able to do the anterior abdomen or flanks with that. But it's usually not enough to do a full lipo 360 and then one of those other procedures. If you're going to a doctor that's offering that, they're probably breaking the rules in the state of Florida. What are the most common procedures you recommend for someone after significant weight loss? So we're seeing a lot more of this. More people are getting bariatric surgery, and now with the new semaglutide drugs, a lot more people are having significant weight loss, and some people just from hard work, diet, and exercise. Not that hard work, diet, and exercise is not involved with any of those forms of weight loss, but we're just seeing more of it. And this really comes down to what the individual wants, what bothers them the most. This is typically multiple stages that we have to go through to address the problems or the concerns that you have. And so we're really developing a relationship where it's probably going to be more than one surgery to accomplish all the things you want to do. We can only combine so many things at one time. But what are the most common things we do for patients after weight loss? And this includes both men and women. It's tummy tucks for tightening up the loose skin in the abdomen, brachioplasties for the arms, upper or lower back lifts, depending on where you have the majority of your loose skin, thigh lifts, and different fat grafting procedures, because after all that deflation, sometimes you need things like implants or augmentations to help restore your breast volume. Or for the butt, we even do BBLs for those patients because they've lost a lot of volume in those areas. We're trying to take from the remaining fat that you have and augment the areas that you need. How do I know which procedure will give me the results I'm looking for? That really comes down to your relationship with your doctor. You can do your research online, but you really need to go see a board certified plastic surgeon for them to discuss what options are best for you. And you need to have an open mind when you go into a consultation that whatever you were thinking about may not be the most ideal procedure for you. And they're going to tell you all the risks and benefits and the pros and cons of each individual procedure and help guide you into making the right decision for you. How do I choose procedure that fits within my budget? So this is, a challenging question, and it's one of the things, I really want people to think about before they choose a practice or a surgeon purely on budget. It is very important to be budget conscious, and we know this is an expensive investment into your health and life and happiness. But you really shouldn't be just choosing on cost alone, because that leads to a lot of other problems. And I'm sure you'll see in some of the forums or chat rooms that if you're going with these very budget places here in South Florida, you're going to run into a lot of problems, especially if you have a complication from your surgery. You're going to be felt left and abandoned. And so don't let that be the primary thing. Second thing is, don't try to combine too many things at once. If you're very budget conscious, it's more important to do things in the right order and do them right the first time rather than trying to shove a bunch of things into one procedure and not doing it all right at the same time. So again, this comes down to the consultation with your surgeon, getting his or her opinion about what you need. What should I expect during my consultation to help me decide the best procedure? That's what we just did. What are the risks of choosing a procedure that isn't right fit for my body type? So again, one of the most common ones we run into with down here in South Florida is people coming looking for liposuction or lipo 360s and BBLs when they're really not the best candidate for that procedure, and they're a better candidate for a skin tightening procedure like a tummy tuck or a body lift. And you come in with an expectation that you really want this one thing, and we say it's not going to be ideal for you. You really push to do that first, and you're like, oh, little loose skin's not going to bother me. And then it definitely ends up bothering you, and then you want to come back and do the tummy tuck or the body lift after that. It's much better to sequence those things the other way, where we do the tummy tuck or the body lift first, get everything nice and tight, and then we have a good canvas to work with when we come back to do the liposuction and BBL. So that's probably the most common one, and something you need to be open about when you speak to your surgeon. All right, everybody, we're cutting it a little short today. I have some more office work to do, but I hope you all have a great day, and if we have any questions, happy to answer them quick.
Will the lipo included with a drainless tummy tuck give you the hourglass shape?
For most patients, yes. Some of it comes down to what your natural shape is, because we're tightening the muscles and we're getting rid of excess fat in the flanks. So for most patients, yeah, it does give you that hourglass shape. But if you're very boxy to begin with and you have visceral fat or something else, it can be a little bit more challenging.
Can you get multiple procedures at once?
Yes, absolutely. We kind of talked about that, and it's limited based off of safety, basically, and what combination of procedures are good to recover with at the same time. And so those are two things that you can talk to your surgeon about during your consultation, but we often combine procedures.
Someone said no question, but thank you so much for your services.
All right, well, you're welcome.
And does it need to be drainless?
No, it doesn't need to be drainless. I have patients that do both procedures. There's mild pros and cons to each of them, but if you're really averse to drains, drainless is a great option for you. If you don't mind drains, the traditional tummy tuck with drains is actually a little quicker, a little less anesthesia time, and so it's not a bad option for those patients as well.
How many lymphatic massages are suggested for a drainless tummy tuck?
I really recommend 20. All right, everybody, have a great day. I will see you next week for Thursday Thoughts.